Good afternoon again, sir. So, for my next video, we have the ankle. So, let's do first the AP projection. So, the IR size used is 8 by 10 inches lengthwise or the 24 by 30 centimeter crosswise for two images on the IR. Position of the patient. Place the patient in a supine position with the affected limb fully extended. Position of the part. Adjust the ankle joint in the anatomic position to obtain a true AP projection. Next is flex the ankle and foot enough to place the long axis of the foot in the vertical position. So let's ensure again the gonad shielding of the patient for the radiation protection. So for the CR or the central ray, it should be perpendicular through the ankle joint at a point midway between the malleoli. So this is my ankle joint. So the central ray should be perpendicular in the ankle joint. The resulting image shows a true AP projection of the ankle joint, the distal end of the tibia and fibula, and the proximal portion of the talus. So let's not forget again to put annotation. So I used my right foot and let's not forget to only collimate the area of interest. And since I am just using a DIY, so I cannot adjust the collimation, and I cannot expose the area of interest, but this is how it looks. And now let's proceed to the next projections. We have the AP oblique projections, which includes the medial rotation and lateral rotation. So first, let's perform the medial rotation. So the IR used for this is 8 by 10 inches lengthwise or 24 by 30 centimeter crosswise for two images on one image receptor. Position of the patient. Place the patient in a supine position with the affected limb fully extended. Position of the part. Center the IR to the ankle joint midway between the malleoli and adjust the IR so that its long axis is parallel with the long axis of the leg. Dorsiflex the foot enough to place the ankle at nearly right angle flexion. The angle may be immobilized with sandbags placed against the sole of the foot or by having a patient hold the ends of the strip of bandage. So in this position, just rotate the patient's leg primarily and foot for all oblique projections of the ankle. Because the knee is a hinged joint, rotation of the leg can come only from the hip joint. Positioning the ankle for the oblique projections requires that the leg and foot be medially rotated to 45 degrees. Next is ensure the gonad shielding of the patient for the radiation protection. The central ray should be perpendicular to the ankle joint, entering the midway between the malleoli. So this is the malleoli, between the malleoli. The 45 degree medial oblique projection demonstrates the distal ends of the tibia and fibula, parts of which are often superimposed over the talus. The tibiofibular articulation also should be demonstrated. And again, let's not forget to put the annotation. And next and lastly, for the AP oblique projection, we have the lateral rotation. The IR size used is 8 by 10 inches or the 18 by 24 centimeter. Position of the patient. Seat the patient on the radiographic table with the affected leg extended. Position of part. Place the plantar surface of the patient foot in a vertical position. And laterally rotate the leg and flex 45 degrees. So this is the right side, so let's flex laterally. And next is gonad shielding for the radiation protection of our patient. Central ray, it should be perpendicular, entering the ankle joint midway between the malleoli. So this is the ankle joint, this is the malleoli. The lateral rotation oblique projection is useful in determining the fractures and demonstrating the superior aspect of the calcaneus. So let's not forget to put again the annotation. For the last projection, we have the lateral, which includes the lateromedial and the mediolateral projections. So let's start first to the lateromedial. So image size used is 8 by 10 inches or the 18 by 24 centimeter. Position of the patient. Have the patient supine position and turn away from the affected side until the extended leg is placed laterally. Position of the part. Center the IR to the ankle joint and adjust the IR so that its long axis is parallel with the long axis of the leg. Adjust the foot in a lateral position. Have the patient turn anteriorly or posteriorly as required to place the patella perpendicular to the horizontal plane. And gonad shielding for the radiation protection. Central ray perpendicular through the ankle joint, entering 1.5 inches superior to the lateral malleolus. So this is my lateral malleolus, and 1.5 inch or 1.3 centimeters superior to the lateral malleolus. The resulting image shows a lateral projection of the lower third of the tibia and projection of the lower third of the tibia and fibula, the ankle joint, and the tarsal. So again, let's not forget to put annotation. Last one is the mediolateral of the lateral projection. So the IR used is 8 by 10 inches or 18 by 24 centimeter. Position of the patient. Have the patient supine position, turn toward the affected side until the ankle is lateral. Position of the part. Place the long axis of the IR parallel with the long axis of the patient's leg and center to the ankle joint. Ensure that the lateral surface of the foot is in contact with the IR. So this is the lateral portion of my foot, and let's ensure that it is in contact to the IR. Next, dorsiflex the foot and adjust it in the lateral position. Dorsiflexion is required to prevent the lateral rotation of the ankle. And lastly, again, the Gonan shielding for the radiation protection of the patient. For the central ray, it should be perpendicular to the ankle joint, entering the medial malleolus. And the resulting image shows a true lateral projection of the lower third of the tibia and fibula, the ankle joint, and the tarsal. And let's not forget again the annotation. Thank you, sir.